a big role, it sucks. It's just not good. And the fact that that is a surprise is very surprising. Because any industry that has attempted to be centrally planned, where the government stepped in and dictated how it should be run, what parameters it should be engaged in, what it could do, what the quality is like, what's good and what's bad, who should be part of that profession. Every sector of the economy where governments have tried to do that, what has been the result? Massive failure. And when they try to do the entire economy, like in the Soviet Union, or like in China, or like in a lot of places, massive failure. But healthcare is different. Healthcare, they're not going to get it right? They can't do it with the price of bread. What happens if the government sets the price of bread? I mean, this experiment has been tried. I mean, Nixon even tried it in this country in the early 70s to set prices. What happens when you set prices? You either set them too low, which is difficult because politicians always give you something free, something cheap. So what happens if you set a price too low? It's just simple economics 101. Everybody wants it, right? Who's going to produce it? It's really low. There's no profit in it. Nobody's going to produce it, but everybody wants it. So you get shortages. You get long lines of bread waiting for the bread. Nobody's producing the bread because it's too cheap. What happens if you set it too high? Everybody wants to make it, right? There's a huge amount of profit. Nobody wants to buy it. Nobody can afford it. So you cannot set prices as a central planner. You can't get it right because what are prices? Yes, economics 101. Where do they come from? They come from this magical phenomenon. It's not really magical, but this aggregate phenomenon of people going out there in the marketplace, voluntarily, interacting. We call it supply and demand. And somehow, every time you go into the grocery store, there's that loaf of bread that you want at the price that you expected, and you buy it. It's almost never the case, even late on the weekend, that you go into the grocery store and there's no bread. Almost never happens. And the grocery store is not trashing huge quantities of bread. It's really almost magic. Their ability to match. And that's what prices do. But that's a market phenomenon. You need voluntary people out there going in and buying some stuff and not buying other things and rejecting certain things at a certain price but agreeing to buy other things at another price. That's what happens in the marketplace. But when you bring in some central plan and say, no, the price of it should be this. Why? Because I decided so. I've taken into the factors and run my computer models and it's this. You've taken away all those individual decision makings, all those choices that each one of us makes. All of that is gone. And now you've arbitrarily set it and it's always going to be wrong. It's always going to be wrong, by definition. And we tried it again. I mean, this is not some economist theorizing. This is something that's been tried in almost every country on the planet. And there's almost a consensus in economics. Almost, I say that. It's very close to a consensus in economics that central planning does not work. Doesn't. Except, when they think it might just in this particular special case, like in healthcare or like in bank regulations or in incentivizing people to buy homes and things like that. Because that works so well, right? Because we set the price of mortgages and we set the price of interest, and that works really, really well. So here we have healthcare. We've decided that central planning, we're going to apply it, despite the fact that it doesn't work. So the counter could be, well, private medicine. If you really had private medicine, that would be a complete disaster. That would be complete failure. Where's the evidence for this? So they say, well, there's 30 million people uninsured today in America. So, I mean, first of all, one has to assume that that's a problem. Now, are we getting massive numbers of people dying in the streets? No. Now, you could argue that that's because the government's intervened, and when they go into an emergency room, you have to treat them. And because you have to treat them, there's a real problem, right? What happens with these people that don't have health insurance, go into an emergency room, they get treated, they don't pay their bills, who pays for it?
We do.
Who pays for it? The hospital? I mean, ultimately, we pay for it. We pay for it through two ways. We pay for it through our taxes, the government pays, and we pay through it through higher insurance premiums, because we pay higher insurance because the hospital is billing the insurance companies, not just from me when I go in, who have insurance, but also all the people who don't have insurance. So we're paying for it through taxes and through higher premiums, and that's just wrong, right? That just doesn't seem right. Obama uses that quite effectively when Democrats, when they pitch the thing. We want them to be responsible and give them insurance so they can be part of the system, and you don't have to bear the cost of that. But why do we require emergency rooms to treat them, to begin with? That's a relatively new thing. It was passed in 1986. Now, some of us were around before 1986. And I don't remember people dying all over America because they couldn't get health care before that. Somehow they still got health care. I don't remember a big crisis in 1986 in America of people falling, let flies because they were denied health care. They got it. They bought insurance. They had no choice. Or they relied on charity. But they got health care. So, here's a system. Yeah, it's got problems. What's another big problem with the American healthcare system? They claim it's what? Too expensive. We spend in America more per capita on healthcare than any other country in the world. True. So, we probably spend more per capita on computers than any country in the world as well. Has anybody told you computers are too expensive? You spend too much of your life consuming, I don't know. Why is it anybody's business whether something's expensive or not? Well, it is, in the sense that you're paying for other people's something. So, the average American pays about $10,000 a year for other people's health care. Not for their own, for other people. So, for the most part, you spend more money paying for other people's health care than you do on your own. So you, $10,000, I mean, nobody here, I don't think, pays $10,000 in insurance premiums a year for health care. I don't, right? I've got one of these catastrophic plans, and I have everything, and I don't spend anywhere close to that. But I do spend through my taxes and through high premiums at least $10,000 to pay for other people's health care. Now I care that health care is expensive. Not because my health care, it's because I'm paying for that. Why am I paying for that? It's because it's not a purely private system. In a purely private system, I'd only be paying my health care. And if I didn't want to consume a lot of it because it was too expensive, what would I do? I'd cut back. I'd go to the doctor less. I'd get an MRI only when I really, really, really thought I needed one. Now when I just felt like getting one because what the hell, it doesn't cost me anything and I get to see the inside of my body. Well, I mean, who knows? There might be a tumor there. Why not do a scan quick? But that's what we do now. Because what, $10 deductible or something, and you go and you get a body scan, and you can, you can tell everything doesn't cost me because you're not paying the cost. So we're not comparing the American system private with socialized medicine. We're comparing the American system that's mixed. And that the costs are all due to this mixture, are concerned about the costs that are due to this mixture, to the element of government involvement in it, to a socialized system. And they're both screwed up. We have better outcomes, but we're spending a lot of money. They have worse outcomes, but they spend less money. But these aren't their alternatives. The alternative is way over here. The alternative is a really private system. But it's not even on the table. It's not on the table. It's not what Republicans are talking about. They're talking about tinkering a little bit here and there, but they're not talking about privatizing healthcare. Let's be clear what privatizing healthcare means. It means no Medicare, no Medicaid, no forcing hospitals to treat people in the emergency room. No, capital A, capital O, government involvement in healthcare. None. Let market forces determine all these things. You can't afford health care? We'll talk about what happens if you can't afford health care. So why is it? Why is it that that's off the table, that a truly private healthcare system is off the table? And why is it that we're considering this monstrosity, which is socialized medicine, when again, it's clearly failed? It's clearly failed. And it doesn't seem to bother anyone. What is driving that? And I think this is, it's kind of the same issue that you see this in every issue. Capitalism and freedom work. They just do. Every way it's tried works. The Berlin Wall comes down, and you suddenly discover that there's a real difference between East Germany and West Germany. And there's a reason there was a wall there. The wall wasn't there to stop the West Germans from going into East Germany. There was no massive attempt of West Germans to flee to communist East Germany. But East Germans risked their lives almost daily to try to cross their wall into West Germany. And when the wall came down, we realized exactly why. East Germany was horrible. The quality of life, the standard of life was horrific. West Germany was thriving. Now, West Germany is not exactly pure capitalism, but it had some capitalism, it had some freedom. East Germany had none. Where do people go? They go from no freedom to some freedom. How did Hong Kong come into it? Anybody beat Hong Kong? It's a tiny little rock, right? It's a rock. It's an island rock. It has nothing. It has a port. That's it. There's nothing there. It has now 6-7 million people live in this rock. It's very, very crowded. Very crowded. Where did these 6-7 million people come from? Because originally there was pretty much nobody in Hong Kong. They escaped every other country in the region. Primarily communist China. It goes to this rock. Why? They were left free. No safety net. No health care provided by government. No social security. No welfare. Nothing. You either succeeded to provide for yourself or you died of starvation. That was it. And yet, everybody left the comforts of communism and the comforts of socialism from all over Asia to come to this little rock where they will promised nothing. And the skyscrapers and the prosperity and the lights, it's an amazing spectacle. Hong Kong. A testament to their success. They did it. They built something. They created something. They didn't die in the streets. They didn't die of starvation. They made of themselves something. They're successful. And when I remember when China took over Hong Kong in '99, was it? There was this whole debate of, is Hong Kong going to go away and what's going to happen? And I said, I guess, pessimistic that Hong Kong would disappear, China would crush it. China wasn't, was still not even as free as it is today, and today it's not very free either. But I made the argument that the one positive that could come about is that if Hong Kong took over China, in a sense, ideologically, that is, its ideas went from Hong Kong to China, which I think is happening. It's been happening since the 1980s. And that's what China's thriving. It's thriving to the extent that they're allowing their people to be free, that they're allowing capitalism, that they're allowing freedom in the economic sense. Every experiment out there shows the same thing. When you leave people free, they flourish. When you constrain them, they die. They might die very slowly, but they die. One of the skyscrapers and the dynamism